First, I need to introduce the topic. Maybe start by emphasizing the importance of sex hormones in overall health. Then, differentiate between male, testosterone, and female, estrogen and progesterone, hormones. I should explain their roles beyond reproduction, like affecting mood, energy, and physical characteristics. Next, the symptoms of imbalance. For males, low testosterone could cause fatigue, muscle loss, low libido. For females, estrogen imbalance might lead to irregular periods, hot flashes. I need to explain each symptom clearly, perhaps linking them to everyday experiences to make the speech relatable. Then, causes of hormonal imbalances: stress, poor diet, aging, medical conditions. I should mention how lifestyle factors contribute and maybe touch on environmental aspects like endocrine disruptors. It's important to connect causes to prevention strategies here. Results of untreated imbalances: chronic health issues like osteoporosis, cardiovascular diseases, mental health problems. Highlighting the long-term consequences can stress the importance of awareness and early intervention. I need to ensure the speech is informative but accessible. Avoid jargon, use examples. Maybe include advice on seeking medical help and lifestyle changes. Since it's a speech, the tone should be engaging, encouraging proactive health management. Let me structure each part step by step, making sure transitions are smooth. Also, check the word count. 3,000 words is quite lengthy, so I need to elaborate on each point without being redundant. Perhaps include case studies or hypothetical scenarios to illustrate points. Finally, conclude with a strong message about the importance of understanding and managing hormone health for overall well-being. The intricate dance of hormones within the human body is a symphony of biological processes that shape our physical, emotional, and mental landscapes. Among these chemical messengers, sex hormones play a pivotal role in defining characteristics traditionally associated with masculinity and femininity, yet their influence extends far beyond reproduction. Understanding the complexities of male and female sex hormones, particularly testosterone, estrogen, and progesterone, requires a deep dive into their functions, the symptoms of their imbalances, the root causes of such disruptions, and the cascading effects they have on overall health. This knowledge is not merely academic, it is a vital tool for fostering proactive health management, enabling individuals to recognize early warning signs, seek timely interventions, and make informed lifestyle choices. Testosterone, often labeled the male hormone, is synthesized primarily in the testes, though the adrenal glands contribute smaller amounts. In males, it governs the development of secondary sexual characteristics during puberty, such as deepening of the voice, facial hair growth, and increased muscle mass. Beyond these visible changes, testosterone regulates libido, sperm production, bone density, and red blood cell formation. It also plays a subtle but significant role in mood regulation, energy levels, and cognitive functions like spatial reasoning. While testosterone peaks during adolescence and early adulthood, its levels gradually decline with age, a natural process sometimes exacerbated by lifestyle factors or medical conditions. In females, testosterone exists in much lower concentrations but remains essential for maintaining muscle strength, bone health, and sexual desire. The ovaries and adrenal glands produce this hormone, and its imbalance in women can lead to unexpected symptoms such as acne, excessive hair growth, or irregular menstrual cycles. The narrative surrounding testosterone often oversimplifies its role, reducing it to a marker of virility. In reality, its influence is nuanced, intertwining with other hormonal systems to sustain vitality in both sexes. Estrogen, a group of hormones including estradiol, estriol, and estrone, is predominantly associated with female physiology. Produced mainly in the ovaries, estrogen orchestrates the menstrual cycle, promotes the development of breast tissue, and maintains the health of the uterine lining. It also contributes to cardiovascular health by regulating cholesterol levels, supports bone density by aiding calcium absorption, and affects skin elasticity and moisture. During menopause, the decline in estrogen levels triggers a host of changes, from hot flashes and night sweats to mood swings and vaginal dryness. However, estrogen is not exclusive to females. Males produce it in smaller quantities through the testes and adrenal glands, where it aids in modulating libido, erectile function, and even cognitive health. Progesterone, another key female hormone, works in tandem with estrogen to regulate the menstrual cycle and prepare the uterus for pregnancy. It rises during the second half of the cycle, thickening the uterine lining to support a potential embryo. If pregnancy occurs, progesterone levels remain high to maintain the uterine environment and prevent contractions that could lead to premature labor. In non-pregnant individuals, a drop in progesterone triggers menstruation. Like estrogen, progesterone also influences mood and sleep patterns, and its fluctuations are often linked to premenstrual syndrome symptoms such as irritability, bloating, and fatigue. In males, progesterone is present in trace amounts and is involved in sperm development, though its role is less pronounced. The delicate balance of these hormones can be disrupted by a myriad of factors, leading to a spectrum of symptoms that vary widely between individuals. In males, low testosterone levels, a condition known as hypergonadism, may manifest as persistent fatigue, reduced muscle mass, increased body fat, diminished facial or body hair, and erectile dysfunction. Emotional symptoms such as depression, irritability, or a lack of motivation often accompany these physical changes. Conversely, abnormally high testosterone levels, though rare, can result in aggressive behavior, acne, and an elevated risk of prostate enlargement. In females, estrogen dominance, a state where estrogen levels are disproportionately high relative to progesterone, can cause heavy or irregular periods, breast tenderness, weight gain, and heightened premenstrual symptoms. Low estrogen, on the other hand, might lead to hot flashes, night sweats, vaginal dryness, and bone density loss, particularly during perimenopause and menopause. Progesterone imbalances in women may present as irregular cycles, miscarriages, or severe mood swings, while in men, they might subtly affect fertility or energy levels. The root causes of hormonal imbalances are as diverse as their symptoms. Age-related decline is a natural contributor. For instance, men experience a gradual reduction in testosterone production starting in their 30s, while women face the sharp drop in estrogen during menopause. However, lifestyle factors often accelerate or exacerbate these changes. Chronic stress, for example, triggers the overproduction of cortisol, a hormone that can interfere with the synthesis of sex hormones. Poor dietary habits, such as excessive sugar intake, processed foods, or nutrient deficiencies, disrupt metabolic processes critical for hormone production. Sedentary lifestyles contribute to obesity, which is linked to estrogen dominance in women due to fat cells' ability to produce estrogen. Conversely, extreme physical exercise, particularly in athletes, can suppress sex hormone levels, leading to irregular menstrual cycles in women and reduced testosterone in men. Environmental toxins also play a role. Endocrine disrupting chemicals found in plastics, pesticides, and personal care products mimic or block hormones, interfering with the natural pathways. Medical conditions further complicate the hormonal landscape. Polycystic ovary syndrome, PCOS, a common endocrine disorder in women, is characterized by elevated androgen levels, insulin resistance, and irregular ovulation. This condition not only disrupts menstrual cycles but also increases the risk of diabetes, cardiovascular disease, and infertility. Hypothyroidism, where the thyroid gland underproduces hormones, can indirectly affect sex hormone balance by altering the levels of sex hormone binding globulin, a protein that transports testosterone and estrogen in the blood. In men, conditions like obesity, diabetes, or metabolic syndrome are closely tied to low testosterone, creating a vicious cycle where hormonal imbalance worsens the underlying condition. Tumors of the pituitary gland or reproductive organs, though rare, can also lead to abnormal hormone secretion, necessitating prompt medical intervention. The consequences of untreated hormonal imbalances extend far beyond immediate discomfort. In men, chronically low testosterone is associated with osteoporosis, cardiovascular disease, and cognitive decline. The loss of muscle mass and increased fat deposition raise the risk of insulin resistance, paving the way for type 2 diabetes. Erectile dysfunction, often dismissed as a mere inconvenience, can strain relationships and contribute to mental health issues like anxiety or depression. For women, estrogen deficiency accelerates bone loss, increasing susceptibility to fractures and osteoporosis. Prolonged estrogen dominance raises the likelihood of endometrial hyperplasia, a precursor to uterine cancer, while imbalances in progesterone are linked to infertility and recurrent pregnancy loss. Both sexes face heightened risks of mood disorders when hormones are dysregulated. Estrogen, for instance, enhances serotonin production, so its decline can lead to depressive symptoms. The interplay between hormones and mental health is a critical yet often overlooked aspect of hormonal imbalance. Testosterone influences confidence, motivation, and emotional resilience, so its deficiency can lead to apathy or a sense of lethargy. In women, the cyclical nature of estrogen and progesterone contributes to the emotional fluctuations experienced during the menstrual cycle. Postpartum depression, for example, is closely tied to the dramatic drop in estrogen and progesterone following childbirth. Similarly, the psychological toll of menopause, marked by irritability, anxiety, or memory lapses, underscores the profound connection between hormones and brain function. Recognizing these connections is essential for destigmatizing mental health struggles and framing them within a broader biological context. Addressing hormonal imbalances requires a multifaceted approach that combines medical expertise, lifestyle modifications, and sometimes psychological support. Diagnosis typically begins with a thorough evaluation of symptoms, followed by blood tests to measure hormone levels. In men, treatment for low testosterone might involve hormone replacement therapy, HRT, which can be administered through injections, patches, or gels. However, HRT carries potential risks, such as an increased likelihood of blood clots or prostate issues, necessitating careful monitoring. Women experiencing menopausal symptoms may opt for estrogen or combined estrogen-progesterone therapy, though these treatments are not universally suitable, particularly for those with a history of certain cancers. For conditions like PCOS, management often focuses on lifestyle changes, such as adopting a low glycemic diet and regular exercise, to improve insulin sensitivity and restore hormonal equilibrium. Natural remedies and holistic practices also hold promise in mitigating mild imbalances. Stress reduction techniques like yoga, meditation, or mindfulness can lower cortisol levels, thereby supporting healthier sex hormone production. Adequate sleep is non-negotiable, as the body regulates hormones like testosterone and growth hormone during deep sleep stages. Nutrition plays a starring role. Diets rich in healthy fats, fiber, and antioxidants support hormone synthesis and metabolism. Zinc and magnesium, found in nuts, seeds, and leafy greens, are critical for testosterone production, while phytoestrogens in foods like flax seeds and soy can modulate estrogen activity. Avoiding endocrine disruptors requires conscientious choices, opting for glass containers over plastic, selecting organic produce, and scrutinizing personal care products for parabens and phthalates. Education and awareness form the bedrock of hormonal health. Many individuals dismiss symptoms like fatigue, weight gain, or mood swings as inevitable byproducts of aging or stress, unaware that these could signal underlying hormonal issues. Public health initiatives must prioritize disseminating clear, evidence-based information about the signs of imbalance and the importance of seeking medical advice. For women, understanding the menstrual cycle as a vital sign, much like blood pressure or heart rate, can empower them to track patterns and identify abnormalities early. Men, often socialized to downplay health concerns, benefit from campaigns that normalize discussions about testosterone levels and sexual health. Schools and workplaces can contribute by fostering environments where hormonal health is openly addressed, reducing stigma and encouraging preventive care. The societal implications of hormonal health are profound. Workplace policies, for instance, should accommodate the needs of individuals experiencing menopausal symptoms or chronic conditions like PCOS, offering flexible hours or cooling stations for hot flashes. Insurance coverage for hormone testing and treatments must be expanded to ensure accessibility, particularly for marginalized communities disproportionately affected by health disparities. Research funding should prioritize studies on hormonal health across diverse populations, as most historical data has focused on cisgender men, leaving gaps in understanding how hormones affect women, transgender individuals, and non-binary people. In the realm of mental health, integrating hormonal assessments into standard psychiatric evaluations could revolutionize treatment approaches. A patient presenting with depression, for example, might benefit from having their thyroid or sex hormone levels checked before being prescribed antidepressants. This paradigm shift acknowledges the biochemical underpinnings of mental health and promotes a more holistic view of wellness. Similarly, athletes and fitness enthusiasts should be educated about the risks of overtraining and undereating, both of which can suppress sex hormones and lead to long-term health consequences. The journey toward hormonal balance is deeply personal, shaped by genetics, environment, and individual choices. Yet it is also a collective responsibility, one that demands empathy, education, and systemic change. By elevating the conversation around sex hormones, we move closer to a world where individuals are not resigned to suffering in silence but are equipped with the knowledge and resources to thrive. The path forward lies in embracing the complexity of our hormonal systems, honoring their role in our vitality, and advocating for a future where hormonal health is a cornerstone of overall well-being. In closing, the awareness of male and female sex hormones is not merely about understanding biology. It is about reclaiming agency over one's health. Symptoms like fatigue, mood swings, or changes in libido are the body's way of signaling imbalance, urging us to look deeper. Causes ranging from lifestyle choices to medical conditions remind us that health is interconnected, influenced by countless variables. The results of addressing these imbalances, whether through medical treatment, lifestyle shifts, or societal support, ripple outward, enhancing quality of life, strengthening relationships, and fostering resilience. As science continues to unravel the mysteries of hormones, let us remain curious, compassionate, and committed to using this knowledge to build healthier, more informed communities.